Hi, everyone, and thank you for attending our session 5 of the Career Roundtable. My name is Marcy Lilly, and I'm the career coach for the College of Music and the College of Visual Arts and Design with my co-host Vinod Stresta, Director of Foundations at CVAD. Together, we bring you the Career Roundtable. This is a forum for students to discuss and discover career opportunities in visual arts, design, museum studies, art education, art history, and other fields that may or may not relate to art. The Career Roundtable will provide first-year students and beyond the opportunity to prepare for career possibilities and connect with mentors. So today we will be discussing careers in art therapy with our two special guest presenters. Today's agenda will include the introduction of Mary Roberts and Miriam Reynolds, our Career Roundtable poll post podcast of the month, and our next roundtable session. So with the Career Roundtable, we like to get as many career ideas as possible. So the CVAD Career Roundtable was created solely on the needs of our students by helping them prepare for a career in the arts. This survey will help us successfully plan programming for future sessions. So we love to hear from students what they need the most and what they would like to see in our future sessions. So I will be following up with students who leave their email in the chat today, a follow-up email with the link to our CVAD roundtable poll. And from there, you can give us any suggestions on what you would like to see in the future and how we can make our career roundtable even better. So each session of the Career Roundtable is recorded just in case students can't make it to our sessions. And where you can find those sessions will be on the Career Center website, and that will be careercenter.unt.edu. So if you go to our website, up in the top right-hand corner, you'll see videos. If you click on that tab, you'll see all of our Career Roundtable sessions, and you're welcome to view those at any point. In each session, I like to promote a podcast of the month. This month we have Art Therapy uh, Decoded, and we have this is a podcast by Janet Cody and Lindsay Winslow, and they're just discussing what art therapists do in their profession. So if you are interested in art therapy and you love podcasts, then I would recommend that you listen to that podcast on Spotify. And I believe you can directly listen to that podcast if you look at our session on YouTube, if you just click on that. All right. So in our next CVAD Career Roundtable session, we're going to have guest speakers from Interdisciplinary Arts and Design. We have Dr. Lauren Cross, Professor and Coordinator of Interdisciplinary Art and Design Studies. And we also have Barbara Trappier, Assistant Professor of Fashion Design. And that next session will be on April the 1st, same time, same place, so 11 a.m. to 12:30. So if you can make it, I would love to see you all there. We have two special presenters. We have Dr. Mary R. Roberts, Program Director and Associate Professor at Eastern Virginia Medical School in Art Therapy and Counseling. And we have Miriam Reynolds, Counselor and Art Therapist Liaison of the College of Music and the College of Visual Arts and Design. And we're super happy that you guys are able to be in our session today. A little information about Mary. Dr. Roberts has over 22 years of experience as an art therapist and art therapy educator. She is a registered and board certified art therapist, art therapy clinical supervisor, and licensed professional counselor, and approved clinical supervisor. Dr. Roberts, EMDR Level 2, fully trained in 2004. She is a practicing artist in mixed media painting. In the art therapy program, she teaches assessment, trauma-informed art psychotherapy, advanced trauma-informed and advanced cultural sensitivity content, and case presentation skills. She provides individual supervision and is the clinical internship coordinator. Dr. Roberts has taught adolescent psychotherapy skills, and group supervision, cultural competency, and chaired student thesis work. Dr. Roberts was appointed to the faculty in 2010 and served as part-time faculty beginning spring 2012. Dr. Roberts previously served as vice president of the Virginia Art Therapy Association. Information about Miriam. Miriam Reynolds is a registered art therapist and a licensed professional counselor. She earned her MA in counseling psychology and art therapy from Naropa University in Boulder, Colorado, and a BFA in fine art photography from University of North Texas, so one of our own. Miriam has worked in residential treatment, juvenile justice diversion, community art centers, and private practice. Her clinical interests include creative expression of emotions, ADD, ADHD, anxiety, performance issues, and trauma. She strongly believes that every person has creativity inside that requires expression. So we're super happy that you were able to be in our session today. So Mary, if you would like to go first and kind of introduce yourself and your background, then we'll have Miriam follow, okay?
Hi, everybody. I'm Mary Roberts. I am an art therapist. I think maybe not in the introduction, but is that I have been practicing for a long time, but not exactly where I practice. So in my career, I've worked primarily with adolescents and adults and in a variety of settings from day treatment to residential. The longest time or longest setting was I worked 7 years in a detention facility with youth under the influence of violence. And I have worked quite a bit with veterans and military service members working with PTSD, anxiety, and depression. And just the nice thing about being an art therapist is you can work across the continuum of mental health care and have a variety of experiences and still contribute to helping others through the creative process. So I'll share a little bit about art therapy with you and then some about our education program. Hello, everybody. Just kind of ground us a little bit again. I do teach at Eastern Virginia Medical School. It's in Norfolk, Virginia, so it's a mid-Atlantic coastal type of environment. And this is just kind of a view of our main building that art therapy is housed in. It's a small school. And one of our faculty, Matthew Bernier, who's also a mentor and colleague of mine, actually taught me when I was in the program. I graduated from EVMS in 1997. You can advance. And you can advance again. I already introduced myself. Thank you. So I always like to kind of start with what art therapy is not so that we can kind of ground ourselves to understand what art therapy is. And so a lot of times if you're elevator talking or just chit-chatting with people trying to explain art therapy, they start to ask questions like, is art therapy for artists with problems? No, it's actually for everyone across the lifespan, children, adolescents, and adults. And it's a mental health profession that uses the creative process for healing. Art therapy is not a modality or a tool. It's actually a standalone profession based in clinical psychology and art processes and material prescribed for healing. And I'll talk a little bit about that when I talk about our curriculum. Some folks wonder if art therapy is like a class. And while an art therapist might at times teach someone how to use an art media or how to draw, that's not the primary intention. The primary intention is to facilitate self-expression and healing through engaging in the creative process. Some folks might automatically assume that art therapy is fun. And so it can be fun and engaging, and it certainly activates the whole brain, but it still is a mental health service. And so at times people are working through difficult things and trauma or experiencing discomfort. And so it may not always be fun. And then I'm sure folks have seen adult art therapy coloring books. And I just like to dispel this myth. Art therapy coloring books aren't therapy because the therapist isn't present. They might be therapeutic. And so engaging in art making on your own or any creative process on your own might be therapeutic, but it's not actually therapy. In advance. So what does art therapy look like? Here's an example of a couple of sessions. The image on the left is a bedside session in a children's hospital working with an adolescent who's receiving dialysis treatment. And the session on the right is an assessment session where an art therapist is facilitating 6 drawings in order to learn about the client or patient. So that's sort of what it looks like. It's an interpersonal experience that includes the client, the art therapist, and art. Advance. Art therapy benefits a variety of challenges to wellness and mental illness. So anything from anxiety and depression, life's transitions, helping cope with developmental disabilities, coping with grief or loss, building self-concept and self-esteem. It really can target any of what we might consider kind of medical diagnoses and problems like the DSM-5 when it comes to mental illness, or promote wellness and healing and those types of benefits. Can advance. And art therapists work across the continuum of healthcare. So anywhere from public schools to day treatment centers, residential facilities, group homes, shelters, inpatient care, residential care, can be medical or psychiatric care, detention, prisons, et cetera. So really you might find an art therapist working just about anywhere when it comes to mental health services. Okay. And so what it takes to get to become an art therapist is a master's degree in art therapy. And in general, our curriculum prepares our graduates to seek 2 different credentials, which I noticed both Miriam and I have. It's just the wave of how people need to function in mental health services. So one is the registered art therapist credential. It's not RAT because that spells rat, and I guess we don't want to be rats. So it's ATR. And this is a national and international credential that's monitored and managed by the Art Therapies Credentials Board. So after a master's degree, you can have supervised work experience supervised by another ATR, and you can earn this credential. And if you choose, you can take an exam and become board certified. Currently in the United States, there are 14 states who have art therapy licensure. And that board certification exam, when you become an ATR-BC, allows you to get that art therapy licensure. More states are seeking art therapy licensure. Currently, the kind of state of the union is 14 have it. Which means that art therapists often need to be dual credentialed or licensed. And so our program also prepares folks for a licensed professional counselor, which means that you're prepared to complete supervised work experience after you earn your master's degree and take an exam in order to earn the LPC. It usually takes about a year to a year and a half of full-time consistent work to earn an ATR, and about 2 to 2.5 years of full-time consistent work to earn an LPC. Okay. So our program, I'll just talk a little bit about the climate. We have a supportive program. Folks come and they're all on a journey together in becoming art therapists. And so they're not competing against themselves. Against each other, they're only competing against themselves. So, there's a real climate of support and kind of going on this journey together. And cohort, meaning everyone starts and finishes the program together. And our cohort used to dress up. This is class of 2015 in monochromatic colors on Monday. So just kind of a little bit of character there for you of what it might be like. And I'll just generally talk about course content and classes. There's 60 to 61 credits required for the master's degree at EVMS, and there's really kind of an integrative approach to the content. So there's foundations in clinical psychology that meet counseling criteria, covering content like assessment, psychotherapy theories, ways of practicing psychotherapy, development, understanding how one develops across the lifespan and applying that to clients, psychopathology, understanding mental illness and disorders, group therapy, facilitating group art therapy and psychotherapy, targeted skills development, an eye to research methods, addictions and career counseling are included. And then we have specific classes related to art psychotherapy. Students learn how to prescribe art processes and media for healing. We have 2 courses, 3 credits each, that are studio-based with some content-based in processes and materials. Trauma-informed art therapy, we teach how the brain interacts with different art media and processes based on the expressive therapies continuum, and also based in neuroscience. And these courses tend to be studio-based. So we have a combination of traditional classes and studio-based classes. Advance. And our students can specialize in different areas. For instance, licensure preparation takes usually a few more courses than the regular curriculum. Art therapy in the schools, medical art therapy, cultural sensitivity and art psychotherapy, and depth psychology. And then we do have study abroad opportunities when COVID-19 is not happening. So if you can advance. One unique thing about our program is 3 different internships. Some programs across the country offer 1 or 2. We require our students to work with each children, adolescents, and adults in 3 diverse settings in order to help them build a wide range of skills and be highly employable. And we do have a 95% employment rate within 6 months of graduation. Advance. And you can just click through the next 3 slides and I'll just talk a little bit. We integrate art making throughout the program. And so many of your classes would involve art making to visualize learning, as well as to process your responses to clients and engage in different concepts. Yes. And we teach from an integrative approach based in social constructivism. So students study and come to class ready to engage on the content. Our classes are interactive. Like I said, we visualize learning and really want to capture this idea of growth mindset, that we're going to provide specific feedback for growth. For instance, you might benefit from supporting your diagnostic impression with multiple criteria using the artwork and behaviors. Or you did an excellent job prescribing this process and media and supporting it with brain-based theory. So here's some examples of just students art making and visualizing learning in class. We also have a 2,000 square foot fully stocked studio. This image makes me laugh a little bit. It's from 7 years ago, so there's quite a bit more materials in there, but it was fully stocked then, and it's maybe overstocked now. But students have 24/7 access to the studio. We really want to embrace the artist side of the artist therapist identity and help you continue to develop as an artist as well as a clinical therapist. And these are just examples of students working in the studio. And we embrace a variety of approaches. We teach multiple theories and approaches to working in psychotherapy so that students can become an integrative therapist, meeting the needs of the clients and best practices of the population, as well as some of their own beliefs. And we are the only program in the country that has standardized patients. These are teachers and actors. So students engage in role play, administering assessments and verbal counseling skills with an actor who then comes out of role and is a teacher and gives direct feedback about skill development. So here on the left, you see the standardized patient in the left, and then the student is on the right taking notes and facilitating a verbal interview. And then on the right are students administering art therapy assessments. So just a little bit of kind of logistical information. If you are interested in art therapy education and becoming an art therapist, we do have an early decision deadline of December 1st for applications, regular decisions February 15th, and we also have rolling admissions. So even if someone missed the February 15th deadline, they could still apply. If our class is full, then we would offer a waitlist position if they meet requirements. But we usually can fit a couple more in here and there. Our class size is usually between 12 and 18, and we only take qualified applicants. The application process is online. I'll talk a little bit about prerequisites. I think most folks who are engaged in the arts want to know about the portfolio. And what we're most interested in for the portfolio is a wide range of media. We're less interested in you being an expert oil painter or one, a fine artist in printmaking. And we really want to know that you've been exposed to a variety of media and have some competency in those. Prerequisites, there are 12. This is pretty standard across the profession and all education programs. 12 psychology credits, 3 that include abnormal psychology, lifespan and development, and theories of personality, and 1 course of your choice in a traditional 3 credit semester format. 18 studio credits in studio art, including a course in painting, a course in drawing, 1 in claywork or sculpture, or claywork or ceramics, and 1 in 3D and sculpture, and then 2 of your choice. So you can see we're really looking for that range of experience. And our application is online. If you've applied to other schools that have GradCast, you can just continue to upload your same application and adjust as needed. We do have an interview process for our program. It is a full day. We prefer it to be in person. We've been doing them online in response to the pandemic. But you'll meet with a program director, get grounded in what the content of the program is. You'll present portfolio images to faculty. You'll have an individual interview with 1 faculty member, a group interview with 2 faculty. You'll meet with students and alumni, and then have a tour, either virtual or on campus. And if you'd like, you can meet with financial aid. We also have a writing sample. Applicants read like a 3 to 4 page article and then write 4 paragraphs responding to that article, just to give us a sense of how you are as a writer. Art therapists document their work in writing, as well as to give you a sense of how we might engage students in assignments. And EVMS's mission is to be community service oriented. So I'll just kind of list a few of our community project so you can see what we're doing. This is our community service learning day, EVMS wide, engaging the community in a variety of arts and crafts and linking to community resources. We partner with the Virginia Art Therapy Association to provide information about art therapy advocacy, and a variety of community events engaging people in art making for wellness. We usually promote Child Mental Health Awareness Day, which is in May, and usually do some type of advocacy here. We also have just actually completed a 2-year project working with veterans in the community at community arts centers, decreasing the stigma of accessing mental health services, linking veterans in need to the VA hospital, as well as helping those step down into the community by attending studio-based art therapy and transitioning into art classes or other arts engagement in the community. We also work with seniors in the community, promoting quality of life, reminiscing, and engagement, social engagement. And we also work with individuals in transition or experiencing homelessness, providing links to services, both basic needs and mental health services. And we recently wrapped up a project helping indirect and direct survivors of our May 31st mass shooting in Virginia Beach, Virginia, that occurred in 2019. So that was a project that was actually both in person at a local arts museum and online. And I would say if you find yourself to be creative and altruistic, that those are the main characteristics that usually draw someone to the profession of art therapy. And then in addition to that, if you have an interest in the theory and science and the psychology and how the brain works related to healing, then EVMS might be a great match for you. You can also follow us on social media. And if you have specific questions, you can certainly contact me at my email here on the screen. So I really appreciate you all listening a little bit about art therapy in our program. And when it's time, I'm happy to answer questions.
Yes, thank you so much, Mary. Awesome presentation. And just as a reminder, if some of you students were coming in late, this is a recorded session, so we'll have these posted on the Career Center website, so you can go back and get any of this information. All right, so up next we have Miriam. So Miriam, you are good to go whenever you're ready.
All right. Thank you, Mary, for covering a lot of the things that I didn't want to cover. So I'm super grateful that you went through a lot of the technicalities, because I'm going to talk to the students about a real personal kind of experience. So not those types of things. Like I'm not going to talk about, a program or anything like that. I will speak a little bit about my program, just a touch, just because it's very strange and very different. It's got a funny reputation, because there's things like meditation that is required, a lot of it. It's kind of like a hippie school in Boulder, Colorado. And I chose it specifically for that reason. But there were times where I was like, I can't sit on a cushion any longer. Like, I can't do this anymore. But anyway, let's see. Because I'm a graduate of CVAD, I remember sitting in a class in the early 90s over in the old art building, where I don't know if it was art appreciation. I don't know what class it was. I was a major, so I don't remember having to take art appreciation, but I must have had to. And that's where I heard the words art therapy for the very first time. And I was already an art major and a psychology minor. And I was like, ooh, what's art therapy? So it kind of just like got put in the back of my mind a little bit. Growing up, I thought I wanted to be a counselor. And then I started taking undergrad psychology classes, and I have a pretty serious case of ADHD, and undergraduate psychology classes I found to be extremely boring. And I had a really hard time sort of focusing and doing the reading for them. Graduate psychology classes are a completely different story, though. Those are very, very interesting. However, I found that undergraduate ones, not so interesting for me, for my brain. And I don't, I can't tell you why that is. Other people might find them very interesting, but I didn't. So anyway, so I just found myself, kind of like gravitating towards the art building, ended up being an art major. So that worked out a lot better for me in my kind of learning style and that type of thing. So, but always kind of had in my mind that I would be, a counselor, but I just was like, how am I going to do school with this brain? How am I going to do traditional graduate school, even with this brain that I have? So that was kind of before I discovered medication and things like that. But anyway, so that's kind of how I found art therapy. It was just mentioned to me. And then after I graduated with my art degree, I started working in a residential treatment center here in Denton. And I was already doing art making with kids. I'm not going to call it art therapy because we don't call it that until it's done by an art therapist. So I was doing, my title was like recreation therapist, which that's not even accurate because there actually is a degree in recreation therapy. But I was doing, I was responsible for the recreation of the kids that lived in this residential treatment center, and started doing art with them, fell in love with that, started researching grad schools, and that's how that happened. Moved to Colorado because there's not an art therapy program anywhere around here. And did pick the weirdest program I could possibly find. I had to double check a few times to find out if it was actually like credentialed, if it was actually like a real program. I just kept thinking, this place doesn't sound like a real school. Like, is this a real school? Like, are they going to give me a degree that'll get me a license eventually? And it turned out to be real. And I did get an actual degree and, was able to get licensed and all of that. And yeah, so that's kind of how all of that came to be. And I'll just say a couple of things. One of the reasons why I chose the program, I was interested in mindfulness and meditation. I was interested in that. It was just a lot of that. And the other thing that I was super interested in is I always had a little bit of a fear of public speaking, and that program was mostly oral. So the exams were oral, and there was a requirement to do a huge presentation in front of the entire community. And so the entire art therapy community and people from the community would come and watch these presentations as a graduation requirement. And so I thought, well, this is a good time to kind of tackle that. And I'm really glad that I did do that. It was terrifying at first, but really glad I tackled that because I do a lot of public speaking at this point. So yeah. So then, in terms of like places where I've worked, I'm just going to show you guys. I don't have a PowerPoint, but I am going to show you a couple of pictures. So I'm going to share my screen real quick. So these have been two of my favorite jobs ever. So one of them is working in a residential treatment center with a kiddo in an art therapy studio that was one of the oldest art therapy programs in the state of Colorado, because that's where I went to school. So I stayed there. Both of these are in Colorado. It's one of the places that I did part of my practicum experience that was required for my school. And then I went back and worked there a couple of different times. And I worked there right before I came to UNT actually too. So that was like studio work. Like I literally worked in a studio with art materials every day. Came home dirty because it was a basement studio with kind of like, it was a building built in like the mid 1800s with like kind of like brick was kind of crumbling a little bit in certain places. And I was just dirty. I was just dirty when I came out of there every day, which for, some of us artists is like a really kind of a nice thing. We kind of like that. So that was that experience. The one where we're seated. Really amazing work happened there. And then the other one Believe that or not, that is work that's being done out of a district attorney's office, a very conservative district attorney's office in Colorado that had a very robust juvenile diversion program where kids that were in trouble with the law for the first time would be sent to counseling instead of court. And there was no art therapy program when I started there in, I don't know, 2003, I think I started there. And when I left in 2014, there were 3 art therapy studios, 3 art therapists, and we were training art therapists there as well. And this was one of the projects that we did. We picked, kind of like a certain area in our district. The area was generally pretty upper middle class, but there was this one area that was had a lower socioeconomic situation, and we picked that area and some kids from that area and kind of like tried to put some resources there. And this project was kind of a result of that. So we kind of partnered with the city, got some funds for this project. And these kids that are shown here were kids that have been in trouble for tagging or spray painting. And so we tried to kind of channel that into this mural. And I wish I had a finished product picture on me, and I don't. But it said community through creativity, and we had a mosaic artist that came and added some flair to this. So in different parts, there were like mosaic on here too. So it was like a very community project, very positive. And the artist got paid for it, which was something that was kind of unusual because the city kicked in some money for it. And we did it with it served as kind of like community service and part of their diversion requirement. And we got a little money for it, and we beautified the neighborhood. It had a lot of components, but I just wanted to kind of share that as a way of like, this is how different this job can look. And so now, of course, you guys know that I work at UNT in the College Counseling Center. So now what I'm doing is a little bit different, although, it's really different right now because of COVID, but yeah, I mean, like Mary said, like there's, this is a career that happens everywhere. And so now what my job looks like is it looks a lot like what a regular counselor's job would look like, right? So students come in here for counseling, and they may or may not be appropriate for art therapy, but we figure that out. And I'm lucky enough to work with art and music students primarily. And so actually art therapy is appropriate for most of my clients. I'm not going to force that on anybody. If someone was like, no, I don't want to do that, then we're not going to obviously do that. But it's worked out pretty well. I do a bit of it. And I do an art group every week. So I wanted to invite all of you guys that are here to my art group. It's Wednesdays from 11 to 12:30. I don't know if you guys have classes. I sent Marcy the link to that group. So hopefully that can be disseminated. I should have probably already done that, but I'm a little bit busy and I don't think to do that. I don't think to send it out. So that is an opportunity for 2 things: for you to participate in art therapy up close and personal, and to watch me work if you're interested in that. If you're interested in this as a career, it's an opportunity to watch me work. We have had, for the last 3 years, psychology interns co-facilitate that group. We're not doing that right now because it's a little bit, it's a little bit different on Zoom, obviously. And so there just hasn't been as much, I just didn't fight for an intern this semester because there just doesn't seem to be as much, I don't know how to say, it just didn't seem necessary. So don't have an intern this semester, but you guys are certainly welcome to participate and kind of like keep an eye on what I'm doing to see if like, that looks like an interesting job or not. And I know that like art students maybe don't want to come and make art therapy on their spare time, but like I do have a couple of like art students who pop in from time to time. So it's kind of an interesting thing. Kind of depends on where you are, I think, with your own art making, whether or not you want to do that. But back to what I do here. So I do crisis, I do intake, I do talk therapy. I am also, like Mary, I'm also EMDR trained. And so I do EMDR for performance enhancement, kind of work with music students a lot of times. And then I do art therapy. And yeah, and then I do outreaches, which is like going around a campus and speaking about what we do, kind of like this. I'd say maybe like an extra kind of fun fact about this job is that I was, before COVID started, I was in the process of getting my dogs trained to be not service dogs, but like animal assisted therapy dogs. Um, and they were coming to work with me when we were training them. And that was super fun. And that was a little bit wild because my office isn't that big. I don't know if you guys can tell, it's not that big. So I would have 2 dogs in here, an art table, and it was a little bit crazy in here sometimes, but it was really fun. Um, I don't feel like I need to tell you guys too much more about like Mary did a good job of covering like how you become an art therapist. So I think we're good there. Let me think what else I want to say to you guys. Oh, Marcy asked the question, and I love this question. Advice for your younger self. So I absolutely love this question. So I think one of the reasons why, I mean, I don't know this for sure because I always did want to be a counselor. So I can't say this for sure. But I think one of the things that drove me maybe away from being an artist versus like wanting to go into art therapy was a little bit of that fear that was, kind of like perpetrated by like my parents and society in general about like starving artists, that whole starving artist myth. And so I think what I would say to my younger self now, if I could go back in time and I could like, try to talk to my, what would I have been like 21 or 22-year-old self about like career decisions, I think I would say, that's great if you want to be an art therapist, like that's a great career. It's a really amazing career. You're not going to regret that. However, if you do want to be an artist, like artists don't actually starve. Like that's not really a thing. And what I know now is that I personally know a lot of artists who are really successful, who make very good livings, live the same level of comfort that I live right now or better. So that's not really a thing, and there might have been times where, I mean, I do have a friend who, chose to live in her studio for a while, and was like totally living this like artist lifestyle where, she was just kind of she wasn't starving at all, but she was like kind of living a real kind of like funky lifestyle in her studio. And I loved it. Actually, I was like living in a nice house with 2 little kids and a full-time job as an art therapist. And I was like, God, that looks kind of nice, actually. Like it looked really freeing to me at the time. But again, she wasn't starving. She was just, and it was a decision on her part. So artists don't starve, like that's just some like BS that we like say to people. I'm not even sure why. Like, I'm not even sure what the purpose is. Like, why would we try to steer people away from a career in the arts? Like, why would we do that? I don't even understand that. One of the things that I do in my outreach work here at UNT is I talk to our psychology interns. And so these are people that are not art therapists. They are not artists. They're not even typically creative type people, really, except for that, being a therapist is a kind of a creative thing in general. But when I talk to them about working with art majors and with music majors, because I can't work with all of you guys as much as I would love to, when I talk to them about working with you guys, I give them a whole spiel about the creative economy in this area. So I researched the whole creative economy of Texas and specifically the creative economy of this little town that we live in. And it is robust. It is, I mean, I like listed all of the businesses in the city of Denton, which is a little town, Mary, not very big. And there's just a ton of them. I mean, there's a ton of like businesses that are doing very well, that are, that fall under like the creative economy. And so we talk about, because I want to dispel that starving artist myth for them, so that if they get an art student in their office or a music student, that they're not looking at them like, why are you majoring in this? This is like a dead end, kind of a road for you. Why would you do that? And so it was important to me that they don't kind of put that energy onto any of you guys. So we, I had to do some research, and Texas has a booming creative economy, as it turns out. But anyway, and then I guess my second piece of advice to like my younger self and maybe you guys is that, when I was kind of picking this career, I I thought it was honorable, more honorable um, to do something in the service of other people. And that is honorable. I mean, that really is. And that is so rewarding. That's one of the most rewarding aspects of my job. Mary could probably say the same thing. Like, it is the most amazing feeling to help someone process something with art making, or to, I mean, just any of it, just to be of service to someone is really, really a great feeling. But being an artist is not a selfish act. It's not a selfish, self-indulgent act. Artists speak about, social issues, social injustices. They address those things. They move our thinking forward. They can help with things. They're not just, kind of like in their studio doing their own thing. And for some reason, as a younger person, I felt like maybe that was the choice. It was either like help others or be like a, I don't know, like more selfish, kind of self-indulgent, artist type or whatever. And that's just not true. That's not how that works. Some of my favorite artists are artists that, do social justice work, that address those things. And so that, again, like, that's just silly. I don't even know why I thought that, but I really did feel like it was the choice of like help others or help myself. And that's just not true. So those are my two kind of, pieces of advice that I would have for myself and or you guys. I don't know if that helps. I will say though, like, you have to figure out for yourself, like, how much security do you need? You know what I mean? And I do think that that's valid. If you're a person that needs security, if you're a person that needs a job with health insurance and a 401k, you know what I mean? Like, if you're a person that needs that, there is no shame or blame in that. Like, you get, you can get a career where that happens. If you're not comfortable being just kind of like this, like, freelance, free spirit person, that's fine. It's all fine. But I just think, like, I had some misconceptions that I was kind of rolling into my early career with. And, I wish somebody would have set me straight with those. But I was just purely like being fed being fed the myths. So I bought right into it and was like, well, I better get myself to grad school. I better pick a different career because this art degree is going to do me no good, and that's just false. I mean, that's not right. I do want to say just maybe like a couple of other little things though. This is a little bit of a gear shift. I wish I could have ended on that positive note, but I just thought of a few things that I wanted to say to you guys. I, like Mary, was also involved in leadership in the art therapy community in Colorado. I was the president of the Colorado Art Therapy Association, and I'm very, very particular about the title art therapy. So I just want to say this one quick thing. If you are looking for an art therapist for yourself, because maybe you want to try it out before you decide if you want to study it, please make sure that that person is actually an art therapist. People claim that if they use art in their practice that they are art therapists. It happens all the time. And that is absolutely not a thing. Just because you say that you make art with people in a session does not make you an art therapist. It is an extremely specialized field. And it's, just because you make art in session with someone and you are a counselor does not make you an art therapist. So I just want to be super clear about that. If you take a class, over a weekend in art therapy, does not also make you an art therapist. It's, my program was 3 years long, very intensive. And then you do like all of this extra stuff after you graduate to get the license and to get the extra, credentials. So, I have now gotten to the point where I do talk to other people about art, like other counselors about art interventions they can do with their clients. And the whole time saying, but you are not an art therapist and this is not art therapy. Like, you can do this, but do not call it this. I used to refuse to tell anyone what I did ever. And I have found that that's not the nicest thing. And so when my my coworkers ask, is there some art thing I can do? I'm like, yeah, okay, we can do that. I now give trainings actually to other therapists, but just the whole time saying, if you're going to do this, we're going to do this ethically, and you're not calling this art therapy. And I'm not teaching you how to do art therapy. I'm teaching you how to do an intervention, right? Just like an art activity that you can do that is not beyond your scope, and it is not, we're not calling it that. So just want to throw that out there, like protect my field a little bit, because it is specialized, and it's not, like Mary said, it's not those color books, and it's not, anything that you do on your own or whatever. It needs to be done with an art therapist. As far as in this area, there are 2 art therapists in Denton. I'm one of them, and the other one is my friend. And I can give you her information if anyone's interested in doing that. And then there's a bunch in Fort Worth and Dallas. So if anyone's interested, the North Texas Art Therapy Association is a good place to start to look for somebody around here.
All right. Thank you, Miriam, so much for that input and your honesty. I really enjoyed that. And one of my questions, we're about to get to the question portion, but yeah, one of my questions was, what was the most rewarding part of being an art therapist? So you pretty much answered that. And we do have a question in the chat. It's from Heather, and Heather is an academic advisor in CVAD and has several students interested in art therapy. For those who wish to stay in Texas for their master's program, is it correct that they can get their master's in counseling, become an LPC, and then just do a little bit of extra work, exam or internship exam, et cetera, to get an endorsement in art therapy?
Miriam, you should speak to that in Texas, but I know it's the same in every state.
No, Mary, I'm new to Texas. So yeah. The short answer is no. There used to be a program up in Vermont where if you already had a master's in counseling, you could go and do kind of a distance program where you would go up for the weekends and it's essentially kind of like another master's degree.
Postmasters.
Yeah. As far as I know, that program does not exist anymore. And so it is not, like Mary said, this isn't like a tool. It's not a modality. It is a career. It is a profession. It is a standalone profession. So this isn't something that you learn how to do, right? It's its own thing. So you cannot just tack it on. That's not how this works. And I know that we're probably like a little protective. I think Mary was nicer when she said it, and I sound a little like mama bearish when I'm saying it. And that's from years of fighting, you know what I mean? Like years and years of like protecting this field that I love so much. But no, that's not how it works. If somebody wanted to stay in Texas, their option would be to do a low residency program. And that might be like St. Mary of the Woods in Indiana, I believe, where you could still live here and travel up to Indiana, like several times a year and do kind of a low residency program. To my knowledge, that is about the only option in staying in Texas. Does that sound right to you, Mary, too? Yeah.
Absolutely. It's the only program of its kind in the country. And then you have to kind of navigate your values around online learning, which COVID has changed a lot of that for us probably. But most programs are face-to-face, full residency programs. And actually, I think if I was an advisor, instead of recommending someone to focus on a counseling master's, I would help them to focus on a master's that covers both LPC and art therapy content and really prepares them. For instance, our graduates, we have some in Texas. I know one in San Antonio. They may have had to take maybe a class or two to fit a Texas requirement, or just learn what those requirements are and figure out the path to becoming a resident in counseling in Texas. But it's totally doable. And so instead of frustrating the creative person who really does believe creativity is healing and has that altruistic spirit, and having them go into talk therapy as a career, I really think it's more beneficial to mentor those students about what art therapy is and foster their belief in themselves to complete a master's program in art therapy. it's really that connection to creativity is healing that's crucial to drive them forward. And so, yeah. I just want to say that Miriam identified her program as a little different and strange at Naropa, but I had the honor of presenting my thesis research at Naropa right after I graduated from EVMS. And so, I think art therapists span the continuum in their theoretical approaches and beliefs, but we also can come together. So it's not that weird. It is unique. But even over at EVMS, I had a transpersonal thesis. So anyway, just kind of embracing the continuum across the country of different programs. It's good.
Thank you, Mary. It is. It's legit. It's legit. I just I have to make fun of it a little bit. I was just like, God, the patchouli and the sage in this place is too much. Like, I just can't with this. The hippie vibe in here is killing me. I mean, I love it. I loved it. Don't get me wrong. There was a reason I went there, but there were times where I was just like, oh my God, can we just shower instead of patchouli on top of this? Like, seriously, people.
Yeah. Asking me after my presentation about a past life experience was probably more than I was used to, but it was good.
Totally. That's Naropa. Love it. I will say the art therapy program is probably one of the most clinically minded programs out of all of the programs there. So I feel like I got a super strong clinical education. I did not get the, just the meditating on the mountain side. We definitely learned to work with all of the clinical issues, but.
Mm-hmm.
Do you have other questions, Marcy?
Yeah, there's another one in the chat from Kimberly. She says, I'm currently a psych major with a minor in drawing and painting. After listening, I'm wondering if I am on the right track. What majors, minors do you recommend for undergrads where the school does not have an art therapy major?
Well, from our program, we actually don't really care if you have an art therapy undergraduate. It's sometimes what you might learn in that experience is conflicting with some values or beliefs we have as art therapists. So really any major is fine. Your bachelor's degree can be in absolutely anything. We actually have had biology majors, sociology majors, all different types of majors come to our program. And we kind of like that because that creates some diversity. And then they have the prerequisites. They have the 12 psychology credits. They have the 18 studio art credits. So, you're on the right track with psychology and art as your core content areas and majors and minors, certainly the right track. But I think it's important for people to know that, diversity is embraced in the profession and you can really come from multiple perspectives and majors. We've had a lot of sociology and women's studies undergraduates who found creativity as healing and connected to visual art making and psychology. So, yeah.
Okay, awesome. Do we have any other student questions? While we wait on that, I did actually have a question. Are there any tips on jobs or preparing students prior to graduation that you could, kind of, I guess, like if they're like maybe teaching workshops or any kind of like teaching or anything like that, like prior to graduation that students should explore that would kind of help them into the field?
Yeah, I can speak to that a little bit, and I'm curious what you think too, Miriam. Some of the things that in a holistic review of applicants that I find compelling is the process of discernment and how someone starts to decide to become an art therapist. And often that comes from some type of service work and some type of service work engaged in art making with others. They don't need to think they're doing art therapy. Or they really just any volunteer work where you can art make with others and you can kind of just experience and see and witness what's happening when others make art is really valuable context to deciding if this is a career fit for you. And so I think that's the key point is discernment process, career fit, and engaging in those activities that might be similar to the work you're going to do in the profession.
Thank you.
I've had some
Yeah.
people, this was more in Colorado when I had, when I was working in a studio that had a lot of upkeep that needed to happen, but I had a lot of undergrad students that would come and just sort of like hang out in the studio and like help me organize the studio or even clean the studio. They were willing to do almost anything just to kind of like get a sense of what it was like. That's not really possible with me now, but I bet at the art station in Fort Worth that I'm sure they need volunteers there all the time because they run a robust art therapy program there. It's called the Art Station because it's in an old fire station house that was, I think, gifted to them somehow. And they, they are an art therapy program. Like that's what they do there. And if you're willing to, roll down to Fort Worth, maybe like once a week or something like that for a bit of time and see what it's like in person. I think that would be, a really great place to start. I think, I think you could even, just get your feet wet, just like come to the group and see what it's like. I mean, just have some experience with it. But for sure, service work always is a thing. And I, like I mentioned, I was lucky enough right after I graduated to kind of work in a residential treatment center where I was allowed to kind of play around with art materials and kids. I wasn't very well paid, but it was work in the field, and so that's a thing too. Those kinds of jobs exist. They need people to, to do those kinds of jobs. So yeah, and I just kind of want to throw it out there. I don't know if this is the right time, but like I have students that contact me all the time, UNT students that want to just meet with me to talk about this one-on-one, and I am more than happy to do that anytime. You would have to make an appointment with me, kind of like going around the intake process at the counseling and testing center. You'd have to kind of ask for like a consultation kind of a situation, or else I'll put you in like you're a client of the center. But I'm happy to do that anytime.
Good to know. I'm over here taking a lot of notes. Perfect. All right. And I think there was a question in the chat, but I think Mary had answered that from Heather. My other question, Mary, you explained that most of your students are hired right after graduation or within that 6 months. What are some of the places, facilities, or treatment centers where do students get hired? If you could kind of explain that.
Yeah, so the climate in Virginia has changed in the past couple of years. So historically, I guess kind of like accounting or any other profession, mental health has some pay your dues type of jobs in order to be a resident in counseling and work towards licensure. And so a lot of folks end up historically doing things like in-home or residential treatment as a therapist because they have structures with a lot of clinical supervision for them to be residents in counseling. In the past 2 years, Virginia has altered their structure, I guess Virginia and Medicaid mostly, such that you can graduate and work in private practice as long as you're a supervised resident in counseling. So we've had an increasing number of students take on some part-time work in private practice under supervision, which is pretty new across the country for requirements and regulations. But primarily, I would say residential facilities, in-home care, hospitals, places where there's a lot of structure for clinical supervision. In the distant past, I would say people easily also got jobs in nonprofit sector, working in shelters or kind of grassroots help type of settings. And I kind of see a balance in that now. And certainly in the state of Virginia, even shelters are becoming more clinically staffed, people with licenses providing services across nonprofit care now more than before.
Well, all right. So thank y'all so much for being here and honestly demystifying like some of the preconceived notions about art therapy and, all of that stuff because, I was also kind of like, well, I had my questions. And so I'm so happy that we could actually get art therapists in this session to talk about those things. So I am so grateful that y'all were here today. And like I said, students will have this information posted on the Career Center website. So you can always review their contact information. And I'll also be sending out follow-up emails to the attendees today about the Wortman's gift card and a poll from our Career Roundtable link. And I will include all y'all's information too, so that students can have that if they have any other questions and they can just reach out to you. But I think we have one more question.
Yeah, I just saw that one come in. I think in my program, it was both. It was my degree is in counseling psychology and art therapy, and I think Mary, your program is the same way. Is that right?
Yes.
It's
And
both.
and I would say there still are there's around 34 approved or accredited programs in the country. Um, I would say there are still a few that are art therapy centric. So, for instance, programs in New York. New York has a license. A lot of people who attend programs in New York don't need the counseling curriculum. And so some of those programs might not have the same integrated content, but many programs do because it's about right to work and preparing you to be able to be highly employable. And so when you're looking at that curriculum content, you want to find a program that has counseling and art therapy content, leading to both credentials. And I would say if you're planning to come back to Texas, that's the route right now. So they don't have standalone art therapy licensure in Texas at this point. And so that would be your main route. States that have standalone art therapy licensure, yes, you could pick an art therapy centric program. But if you want to move, you don't have portability. And so I think just being a smart consumer of your education is really important. And diversifying your skill set by the program you choose can be really useful to you.
My thinking when picking a program was it has to prepare me for an LPC because I don't know if I'll ever get a job as an art therapist because this was the 90s and I didn't know a lot of art therapists at the time, and I didn't know how to like even find an art therapist, right? The internet didn't even exist. So I was like, how do you even know how to find an art therapist, So it,
Cell phones didn't exist.
right. So I just didn't. I didn't know an art therapist. So I thought like, I definitely need to get a program that's going to prepare me for LPC licensure because I know I can get a job that way. And this art therapy thing may or may not work out. So let me do that. And that ended up being a good choice after all. But honestly, I have had every single one of my jobs has been that I have gotten every single job because I was an art therapist also. It has not been a hindrance. It's been nothing but a bonus. I got this job at UNT because I'm an art therapist. That's why my resume went to the top.
For me too, Miriam. I took 7 jobs over the course of my career that were not art therapy jobs. And when I left, they were titled art therapy jobs because that's kind of what an art therapist does. They advocate for the profession and forge the way. And then people want that unique skill set after they have it. Right. So, that constant advocacy is part of the profession, but it's also really rewarding because it's not a new profession, it's just small. And so you're still forging the way because there's not a great mass in numbers.
Thank y'all so much for being here today. We really appreciate your insight and input and expertise on all of this.